Today we're talking about estrogen. Apart from the obvious role in sexual development, the menstrual cycle and fertility, estrogen does loads of other clever things in our bodies, which makes sense of symptoms and the longer-term health complications of the menopause. Also explains the benefits of replacing estrogen in the form of HRT. We have estrogen receptors throughout our body, from our brains, bones, bowels, joints, skin, heart, and all our major organs, and of course our genital reproductive. A very simple explanation is that without estrogen, these parts where we have these cells don't function as well. This explains why menopause transition symptoms can affect our whole body, from brain fog to vaginal dryness to aches and pains. Of all these sites, estrogen plays a very significant role in bone, heart, and brain health. In our bones, estrogen regulates bone turnover, reduces bone breakdown, and promotes bone development. Postmenopausal women, without the protective effect of estrogen on bone health, experience a significant increase in bone loss, or, as it is easier to call it, a loss of bone density. This increases the risk of osteoporosis and fractures. The impact of this is huge. 1 in 2 postmenopausal women will have an osteoporotic fracture. 500,000 disability-adjusted life years are lost as a result. 10% of women will die within 1 year of a hip fracture. HRT is robustly evidenced to improve bone health and is deemed as effective in treating osteoporosis in menopausal women as any other current available treatment. In our cardiovascular system, estrogen has an anti-inflammatory, relaxing effect on blood vessels, which helps to control blood pressure. Estrogen also increases the ratio of good to bad cholesterol, which reduces atherosclerosis development. Think of atherosclerosis as the gunk inside your hosepipe. The powerful combination of these effects reduces the risk of heart disease and strokes. 1 in 5 postmenopausal women will have a heart attack. There is a 4-fold increase in cardiovascular disease in postmenopausal versus premenopausal women. HRT is started in the window of opportunity, and by this we mean under the age of 60 or within 10 years of the last period, has been proven to reduce cardiovascular disease, to reduce atherosclerosis progression, reduce cardiovascular death, and reduce all-cause mortality. If started outside of this window, there is no cardiovascular benefit, but importantly, there's also no cardiovascular harm. And onto the brain. The same relaxing effects on blood vessels that we see in the cardiovascular system, we also see in our brains, ensuring good blood flow in the brain, assisting with memory, cognitive function, and fine motor skills. Both endorphins and the feel-good neurotransmitters serotonin and dopamine are boosted by estrogen, which helps regulate mood and reduce anxiety. And the impact: 40% of women in the menopausal transition will report memory and concentration issues. 15 to 50% will report anxiety symptoms. Estrogen replacement is, again, robustly evidenced to reduce cognitive, mood, and anxiety symptoms in the menopause transition. Women who have had longer estrogen exposure, so early menarche, that means start of your periods, late menopause, no or few pregnancies, have been proven to have better brain health as they age. However, there is not, yet, a proven reduction in dementia associated with HRT use, but being closely studied. There is a suggestion of reduction in Alzheimer's in women with premature ovarian insufficiency or early menopause who are receiving HRT. Unfortunately, it's important to note that if we start HRT late, so after 65 and before 79, there is actually an increase in the dementia risk. So, overall, with the knowledge of what estrogen does, it's clear to see how replacing estrogen as our natural levels of estrogen fall through the menopause transition is beneficial for both symptom control and long-term health. However, The primary benefit and the sole licensed indication for replacing female hormones in women over the age of 45 is to manage the symptoms of estrogen deficiency. In these symptomatic women over 45, within the therapeutic window that we spoke of, HRT provides evidence-based benefits to bone, brain, and cardiovascular health alongside the symptom control. HRT is not yet licensed for disease prevention in the absence of menopausal symptoms. Okay, so that's all for today. Thanks for listening.